Good morning.
Good morning.
Good morning.
Thanks so much for joining us, everyone. We'll give a minute or two for folks to trickle in, and then we're excited to get started.
Good morning, everyone. I know that there will be folks that will continue to join us as they grab their coffee and get to their seat, but want to go ahead and kick us off and get started. It is Friday morning, and um, glad to be spending it with you all. I'm looking to the side out my window. It's starting to feel like fall. It's the part of fall that I really like, where the nights are cool and crisp, but during the day the sun's still shining and it's still a little bit warmer. Hope that you all are able to enjoy some of that this weekend and take some time for self-care with family, friends, or just by yourself, if that's what this week needs for you. We are really excited today to have a great group of panelists. The topic today is talking about community needs assessments. Many of you do them, some of you use them, and all of us need to have a kind of a better understanding of what are the needs in our community and how we can use those to connect with the work and connect with our community. And this topic came from some folks on this call, so we hope that you will find some good new information in it, or maybe some reinforcement of information you already knew. So I'm going to turn it over to Deja, who's going to introduce our guests.
Good morning, everyone, and thank you, Sarah. I am happy to be here again on a Friday morning with you all. I see some familiar names and hopefully some new faces here. So just want to reintroduce myself. My name is Deja Cyrus. I'm the manager of organizational development for our sector support team here at United Way of Central Indiana. Today's topic of community needs assessment is a very exciting one, and I'm thrilled for you all to meet today's panelists. We'll even be afforded the opportunity to witness an actual demonstration of a community needs assessment tool. So moving along, today we'll have the opportunity to gauge and improve our understanding of community needs assessments in Central Indiana. We have the chance to discuss and learn from three exceptional professionals that are highly versed in this topic. Participating in our panel discussion today, we have Jackie Lai of Big Brother, Big Sister of Central Indiana, Jay Colbert of the Polis Center at IUPUI, and Nisa Meyer of Putnam County Community Foundation. Each of these community leaders come from an organization that provide a unique perspective and approach to community needs assessment. So let's go ahead and just dive in with them. I want to give you guys a chance to introduce yourselves and tell us a little bit about your organization. So Jackie, I'll start with you. If you could tell us your title, the organization you're at, your role at the organization, and a little bit about what your role at your organization plays like within the community.
Sure. Yeah. Thanks, Deja. Hi, I'm Jackie Lai, she, her. I'm from Big Brothers Big Sisters of Central Indiana. I'm the senior director of community engagement and JEDI initiatives. JEDI stands for Justice, Equity, Diversity, and Inclusion, just kind of what we call it over at Big Brothers Big Sisters. I know a lot of you have heard about Big Brothers Big Sisters. Essentially what we do is we create and support one-to-one, usually community-based, so out in the community, mentoring relationships that help benefit, honestly, the youth, the mentor, the family as a whole, in hopes of increasing social capital for everybody involved. Deja, did you say talk a little bit about community needs assessments, or are you waiting?
Well, so just like about like your community, I mean your organization's involvement with the community. So
gotcha. Yeah. I mean, we serve over 1,000 youth and families, probably 1,100 plus mentors. So we've been able to really grab a lot of great information about needs from all of the people who are involved in our program. So kind of excited to talk about how, honestly, community needs assessments is just kind of a part of our entire service delivery model.
for sure. Thank you, Jackie. And then Jay will transition to you. So again, if you could just tell us your title, your organization, your role with the organization, and a little bit about what role your organization plays in the community.
Sure. Good morning, everyone. I'm Jay Colbert. I am the data manager at the Polis Center at uwci. So we do a lot of different things at Polis. Most of it revolves around data in one form or another. If you're familiar with the Savvy Community Information System, that's a Polis project that I spend a lot of time working on. So we take data from a lot of different source providers. Census Bureau is a big one, and state and local health departments, some really obscure national federal agencies that have some interesting data. And so I'm not necessarily an expert on community needs assessments. The needs assessments we've done have been more focused on, community health needs assessments that we'll do for hospital systems. But I have spent a lot of time gathering data for people who do create community needs assessments. So I'm more, well versed in the data side of it, and also be showing a Savvy tool that's available publicly to everyone today later on that you can kind of use to start as a start to your community needs assessments.
Okay. Perfect, Jay. And actually, everyone, if you weren't aware, I am dropping a couple of resources in the chat as they are discussing their organization. So feel free to take a look at those. But Nisa, good morning and thanks for joining us. Similar to Jay and Jackie, if you could just tell us about your role, your organization, and how it connects to the community.
Absolutely. So good morning. My name is Nisa Meyer. I'm the executive director at the Putnam County Community Foundation. Our office is located about 40 miles west of Indianapolis in Greencastle, Indiana. So in short, I know many of you have relationships with community foundations, but really we are grant-making public charities that are dedicated to really improving the lives of specific geographical areas. So for us in particular, we are serving Putnam County, Indiana. So community needs assessments and the data we receive from those assessments play a critical role in the work that we do, serving our community, as well as serving our community partners that are doing some of the work in our communities as well.
Awesome. Thank you, Nisa. Okay. I know that we're on the topic of community needs assessment, and one of the things that we wanted, if you're not speaking, if you could go on mute, please. But moving on, one of the things that we're wanting to emphasize to our participants and attendees is that every community needs assessment can look different. It can look different at every organization. So if we could go through and just tell our attendees what your organization's experience with conducting or contracting a community needs assessment is. And Jackie, will go back and start with you.
Sure. Yeah. So I kind of hinted at this a little bit before, but I would say at Big Brothers Big Sisters, our entire service, how we conduct our service, is kind of like a community needs assessment. So from the very start, we're grabbing information from every mentor, mentee, family. We conduct 1 to 2 hour in-person interviews with all of these individuals as they go through our process, grabbing all that information, putting it in our database to be able to inform how we support them best. Now everything is a little bit individualized. We get what each of these individuals need, but I mean, we follow up with monthly, quarterly support calls to continue to grab more information from all of our program participants and be able to, again, like support and see what were kind of the trends that we're seeing throughout. I'd say it's always, we're always trying to improve in terms of, okay, we're getting this mass amount of information our way from all of our program participants. So how do we compile that together in the best way possible, in a concise, like, results manner? We actually, I see Cecily on the call, but we actually, for our most recent 3-year strategic and JEDI plan, worked with Taylor Advising to conduct almost like an even bigger community needs assessment that kind of interviewed, surveyed over 100 plus constituents and stakeholders to be able to help inform kind of like what does the community need from us? How should we be adjusting our programming to be able to provide the best services possible? And so that's been really helpful. We always try to uplift and elevate community voice in every single part of our programming and organization. So we've done that in several ways. And obviously, Jay, you're from Polis. Like, we use Savvy, we use IYI's Kids Count data book. Like, those are very easy resources to be able to just research. We talk to other youth development professionals. We talk to other folks in the nonprofit sector, try to knowledge share, create spaces that people can come together to be able to knowledge share. All of that is just kind of all a part of what we do, and we try and like take all that information together and be able to provide the best service possible for families in our community.
Absolutely. Okay, thank you, Jackie. And then Nisa, moving along to you, if you could just provide us some insight, because you've been with Putnam County Community Foundation for quite some time now, right?
That's correct. So I've been with the foundation for nearly 5 years. I've been in this role for about a year and a half. So I'm still learning, but we've gone through the process a few times. So I'd be more than happy to share a little bit about that.
Yes, if you could.
Absolutely. So kind of going back to the mission of the community foundations, we're here to really serve our community. So to maximize our ability to serve our communities, it's critical for us to know what the needs of our community are. So here at the Putnam County Community Foundation, we have both conducted community needs assessments ourselves, as well as contracted those out as well. So at this time, we are currently going through a community needs process. We started that at the beginning of 2023, and it is a long process for us. So at this time, we've committed to doing them every 3 to 5 years to really drive the work we're doing internally, as well as I said, to really align the work that we're doing as a whole for our community to really move the needle forward. So I think there are pros and cons for both options for conducting yourself as well as contracting out. And really, when you're considering what that looks like for your organizations, really looking at budgetary constraints, the capacity of your team, and the resources that you have at your disposal, really to determine that best option. So, like I said, we utilize those results internally. So internally, we are utilizing them to determine our strategic planning work, our grant making initiatives, as well as the community programs that we're putting out into the community. And then really hoping that while sharing the needs and the information we gather through the process back out to the community, it really aligns our community as a whole to once again collaborate and convene to how do I say this? What we have found is some of those areas are very large issues. I mean, we'll touch on them a little bit later, I believe, but we're finding housing, affordable health care, early childhood education are really big needs here in Putnam County. And that's not one entity that's going to solve those issues. So by sharing that information out and the needs from our community members themselves, it can drive that work and that collective impact together.
For sure. Thank you, Nisa. And then Jay, your role is a little different at Polis than Jackie and Nisa are in their organizations. You deal a lot with the data analysis, the data management of community needs assessments. So if you could just tell us a little bit about your experience with community needs assessments at the Polis Center IUPUI.
Right. So we have assisted a lot of organizations doing community needs assessments and also community health needs assessments. A lot of times, though, we don't even see the end result of some of those needs assessments. So I kind of, don't feel like the expert on the actual end result of the needs assessments. Though I do want to talk about a couple of, data things to be aware of, and Jackie kind of talked about this a little bit, but there's a couple of different types of data you can use in a needs assessment. There's secondary data and there's primary data. So secondary data is data that somebody else has already gone out and collected for you. The best example being census data. So census is, sent out all these surveys and collected all the information and published all of that. And so we would call that secondary data. Now, the other type of data you can use is primary data. And primary data is data that you yourself go out and collect, whether it's through your own surveys or focus groups, interviews, whatever. So both of those types of data are important. Now, one thing to remember, this short little saying, secondary data first, primary data second. So you want to do secondary data first just because it's kind of easy. It's easy to just go download some data, kind of get a feel for what data is available, kind of the overall situation of a neighborhood or an area. But then primary data is also important because while secondary data is easy, it doesn't always tell you exactly what you want to know in an area. So with primary data, you can answer all those questions exactly how you want. You can ask people the questions exactly how you want them to be asked. You can do these interviews and get that firsthand information, but it's a lot of work, right? It's a lot of labor, it's a lot of time, it could be a lot of dollars as well. So just remember that, do what you can with secondary data first and then move on to primary data to fill in those gaps.
For sure. And if an organization was looking to assess some secondary data, is there a way that they can find it? That they just go on Google and look for it? Like where should they look?
Yeah, so I have to give a plug to Savvy at this point. There is a lot of information in Savvy. It's a very good first place to look for what data is available. And we also list the data sources that we use to create these tools. So even if you can't get exactly what you want from Savvy, you can go to these other sources, direct to Census Bureau to get their data, or, we might not even publish data from certain data sources, but we would still include them in, a potential data source list. So you can kind of go explore those on your own.
For sure. Thank you, Jay. Okay. Well, Nisa, I'd love to hear from you. How have your findings from the community needs assessment influenced your organization's subsequent actions, initiatives, or programs? Because I know that you guys are more focused on the philanthropic side of it. So if you could just bring us a little bit into that, that would be really helpful.
Absolutely. So as I mentioned, why we do the needs assessment is to really kind of inform the work we do, to truly have a true understanding of the community. So as Jay mentioned, that primary and secondary data, we've taken a role of utilizing both, and really that secondary is a census data, but really utilizing that primary data through stakeholder interviews, focus groups, a community-wide survey, et cetera, to truly ensure that we're informed there. So we are always improving and trying to find ways to best align our work with the needs. So there's always room for improvement here. When our current strategic plan states that we are going to identify a major need in Putnam County and to address it, and what better way to do that through the community needs assessment. So that need is really driving our strategic planning and the work that's tied there. Now our grant making, we only have limited philanthropic dollars to serve out to the community. So what best way to ensure that those have the largest impact in our community than aligning with those with the needs that we're finding in the community needs. So I anticipate over the next year that our grant making program may have some changes to align with the needs that are identified through the current needs assessment process. And then our community programming, once again, the programming that we provide out to our community. It's more of a limited basis that the Community Foundation does, but is it capacity building for nonprofits? Is it us doing more educational events, et cetera? We don't know what that looks like with the current needs, the assessment we're going through now, but really hoping it drives our work forward.
For sure. Thank you, Nisa. And then Jackie, I know that at Big Brother, Big Sister, you guys work you're very involved with the community. So given your proximity to the community and their needs through your work, how do you avoid confirmation bias and letting preconceptions like impact the community needs assessment data?
Yeah, I mean, this is really hard because, you know, we're very focused in what we do in supporting youth. So what we hear a lot from individuals, or what comes like rises to the top kind of, is what people talk, like it's who is talking about it more, right? I would say honestly, a lot of it is relying back on like looking back at Savvy, looking back at IYI's Kids Count data book to be able to confirm whether or not some of the things, some of the trends that we're seeing in families or within the community is substantiated. I think always being able to rely on some of those resources. We just have a bunch of great resources within the community to be able to draw from. And so if you don't have the time or the resources to be able to complete a full out community needs assessment, I mean, Savvy and IYI do great work to be able to provide that data for you, and be able to just make sure that, yeah, we're not biased in some of the things that we're just hearing when we're having conversations, and we're taking the full scope and full picture of the community into mind.
Nice. Okay. And Jay, I know that you kind of spoke to the Savvy tool as a resource, but do you have any other resources, time, internal expertise, like on if a nonprofit who does not have those resources or the expertise that you do, or have access to those means, how would you recommend they take the steps to identify the needs within the community?
Right. So they would just have to, identify the best source that is available. If this was maybe an organization that is like outside of central Indiana, so they might not have access to a ready-made community information system. There's other resources out there. I would certainly start, I think, with the Census Bureau's website. If you had no place else to go, the Census Bureau's website, it's data.census.org. They actually have some pretty decent community profiles in there. So, you can select a county or a township or a census tract and get a decent profile from there. One thing that it does not do at all is combine geographies. So if you're defining your area as a collection of counties or census tracts, Census Bureau is not going to do that math for you. You'd have to go to the point where you're downloading tables and then adding numbers together in a spreadsheet. But if your area is just a county or a single township, then those census profiles are certainly a good place to start. And a lot of it depends on kind of your organization's capacity for data analysis. Some people might, have, more of an ability to, like deal with some of these data sources. 'Cause a lot of these data sources, it's not just, like getting some easy numbers. You got to download and put it in a database or spreadsheet, do a pivot table or something like that. So it can be a lot of work, and it can be a big barrier depending on where you are and what capacity that you have.
For sure. Okay, thank you, Jay. And I'd love to hear if you guys could just provide some perspective from each of you as an expert. If you could go back to before you conducted your community needs assessment, what do you wish that you would have known? Would you have done anything differently? Would you recommend a community member considering for conducting a community needs assessment? What would be your biggest takeaways from it? So, Nisa, I'll start with you.
That's a great question. I think my biggest piece of advice there, kind of looking back, is to take your time, trust the process, and I think really important is ensure, especially if you're going to take on the primary data collection, actually through that process, ensure you have the buy-in from your entire organization, both staff and board. I think it's important to have that collective work. I think something that I would like to touch on just briefly is like that bias piece for us, since we were collecting the primary data ourselves. We did hire a third party to do the data analysis for us, as well as we did have third-party volunteers come in and facilitate the focus groups in the individual one-on-one stakeholder interviews. So although we were doing the collection of it, we didn't want the bias of our individual staff members and board members to really influence the work we're doing. So if you have that ability to do that, I think that is huge. But it is a lengthy process, and I think it is vital to the work that many of us are doing. But once again, evaluating if you have the time, capacity, and resources to do it. And if not, to do that primary collection piece yourself, as Jay mentioned, there's so many wonderful secondary pieces there as well that are readily available to us. And I'll just put a little plug out for check with your community foundations, see if they've done any primary data collection work. And I think that is dependent from county to county, but they would be a great resource for you to check in with as well.
For sure. Thanks, Nisa. That's great insight. And Jackie, we'd love to hear from you next.
Sure. I feel like this is the tale as old as time. I think that when you are conducting a community needs assessment, being ready to implement whatever changes that come out of that assessment. I mean, it's the hardest thing that to do at the end of the day, is to be able to take those findings and be able to figure out the right way to implement it with everybody's, staff time capacity stretched thin, but planning as much as possible to figure out, okay, where can this fall if I'm gathering all this information about something, where does it fall to kind of get it done in terms of getting that change implemented. I mean, I think that's just something that probably everybody struggles with, but it's always something that we think about just in terms of, okay, we've done this thing, how are we making the best use of it to really be able to benefit our community members and program participants.
Deja,
Thanks.
May I add something to what Jackie just said?
Yeah, absolutely.
I think for us, I just want to add something is, unfortunately, the action sometimes takes time. And that's the hardest part sometimes, especially for stakeholders to see that. So keeping them informed through the process, I think, is really important. So especially if you anticipate taking a longer period of time than you hoped, et cetera, keeping them informed, especially if you're holding those stakeholder interviews, focus groups, the surveys, keeping them updated through the timeline process will really increase that buy-in, and also motivating your team to continue with that piece of action.
Thank you, Nisa, for adding that in. And then Jay, in case anybody doesn't know, Jay has his experience is a little different. He does more so the data analysis side of things, but he has over 20 years of experience. So Jay, we would love to hear your insight on this question.
Yeah, I'm going to answer this question kind of from the view of a community health needs assessment that we've done a few of. And so a few things I would say. One is like do some research, see how other people have conducted needs assessments and try to learn from their mistakes before you have to learn from your own mistakes. And there's also, certain strategies to try to prioritize your effort. So in community health needs assessments, there's this one concept, it's called the Hanlon method, and it's there's like three basic components of it. One, there's like measuring the size of a problem, like how many people are affected by this. So like more people are going to be affected by diabetes than are pancreatic cancer or something. And then like what's the seriousness of the problem? So certain diseases are going to be very serious, very acute, and other things are while they're not trivial, they're not as like deadly or whatever as some other diseases. And then also there's the idea of the effectiveness of potential interventions. So again, some diseases are just social issues in general. Maybe you could do something about it. And then other things, like maybe you just can't do anything about it. Like if going back to certain types of cancers, sometimes it just has very poor prognosis and you just can't do much about it. So, to boil it down, focus on things that, affect a lot of people and they affect them in the most serious ways and you can do something about it. So kind of if you're going to prioritize your efforts, kind of use some sort of logic like that. I'm going to deal with this issue first and then this issue next and so on. So kind of do that background research and kind of figure out a way to, prioritize what you're actually going to do.
Awesome. Thanks, Jay. And I think this is the perfect time to kind of roll into our demonstration of the Savvy tool. So I'll hand it over to you.
All right. Let me share my screen. And so there's a few different tools that we have in Savvy. There's, like Savvy profiles, which kind of the most commonly used tool. But we do also have this. I just want to confirm that you're seeing this Savvy community.
Yep, we can see it.
Okay, I'm not getting the box around I usually get. So this is our Savvy community assessment and planning tool. So this tool was created several years ago in collaboration with United Way. And I don't know if you've been around long enough, you might remember United Way's, gosh, I forget what they call it now, their community assessment book, where the executive summary was this big thick book. And then if you wanted to get the whole thing, you had to get it on a CD. So in collaboration with United Way, we kind of developed this tool to be, more updatable, more interactive and whatnot. So we developed this tool, the assessment tool, and you got to log in, you got to register and be logged in to use this tool because, we got to save the assessments that you create somewhere. But here is a list of assessments that I've created in the past. You can create as many assessments as you want, and it saves them, and you can retrieve them in the future. So I'm going to just click on one of these assessments that I've created in the past, just because it's a little bit quicker. So with this tool, you start by selecting your geography. And in this example, I've selected the United Way of Central Indiana's service area. You can also do this by, we can do by counties, by townships, and by census tracts. And so you select your geographies. Here we've selected multiple counties. The first time you create this, it takes a few minutes to crunch the numbers and move on to the next step. So, but once that happens, you kind of go through this progression here. We've selected our geographies. We're going to set the needs in an area, and then we land on this dashboard here. And so this dashboard has a list of indicators on the left. And then going over to the right, they're broken out in different ways by demographics, by age, race, and gender, and then by socioeconomic status, meaning by poverty and educational attainment. And so you kind of got to get used to how this is presented. But the unemployment rate in this area overall is 5%. The unemployment rate for the Hispanic population is 5%. The unemployment for the Black population is 11%. And so on. And so it kind of does start to reveal some disparities here. So keeping with unemployment, actually, I'm going to scroll down here. I mean, you see how many different indicators there are. I kind of want to look at poverty. So poverty is always kind of easy and interesting one to look at. So this tells us that, the poverty rate for the population with no high school diploma is 26%. The poverty rate for high school diploma only is 13%, and the poverty rate for the population with a bachelor's degree or higher is only 3%. Now, we already knew this, right? I mean, we already knew that poverty is closely tied to educational attainment. But I think sometimes when you see these numbers, it really kind of highlights, kind of the depth of those disparities. Like maybe we didn't know that the difference here was more than, a factor of 8 or whatever the math works out to. So, we all know something, but it's good to kind of look up those numbers so we can confirm to what extent that it's true, and then also be able to share that with other people as well. And also for these indicators, you can click that plus button and it'll show a chart here so we can see how things have changed over time. Poverty's peaking around 2014-15, and it's been coming down since. You can view this information in bar charts. You can view it in a map. You can view it in a table. there's a tab about the data that gives a little bit more information about data sources, and so on. And so that's step 2, assessing needs. Step 3 is identifying assets. This map, once these assets load, so you can pick different types of assets. If you want to see where clinics are, you can do that. You can click on individual clinics, get a little bit more information on them. And you can add different types of information here as well. And you can change the background map here also. Here we're looking at unemployment rate. You can do a few others, poverty rate, graduation rates, and so on. And so you'll notice these buttons here on some of these charts, add to report. So really what we're doing here is creating a Word document that you download. And then as you view these maps and charts, you can add them to the document. Now, step 4, there's really nothing here for you to do other than to kind of read through these questions. And these are things that we think you should be addressing in your needs assessment, questions you should be trying to answer, and so on. Then the last step is actually downloading this Word document. So let me, hopefully this usually downloads real quick. So maybe I can share the results. Well, while that's downloading, I do need to point out that there is an issue with this tool. It's kind of stuck on 2010 census tracts. And so we're kind of stuck on 2019 data on this. And, we're aware it's an issue, and we're kind of trying to get our plan together for, getting over that hurdle and then updating to the newer geographies and adding probably a couple other geographies along the way. So keep that in mind. I'll also point out that we have, there we go. Let me show this Word document that gets downloaded. And it's just a Word document, completely editable by you. So you can change the title if you want. You can put your own picture in here. You put whatever other information in there. And then we kind of have some placeholders in here. So, we're just telling you to insert some description of your projects and goals. There's some methodology. There's some maps that we put in here automatically. And so on. This is kind of from previous edits I've done. So keep in mind, this is not like the end of your assessment, but it might be a pretty decent beginning as well, because there's still a lot of work to go from there. Let me quickly point out the Savvy's Community Profiles tool, where for the Central Indiana area, you can select, certain geographies. This is census tracts. You can also do townships, counties, zip codes, and so on. And then you create the profile. I went ahead and created this just to save a minute or two of processing. But so this is the Martindale Brightwood neighborhood. You add different data cards. This data is up to date as much as it can be. It's 2020 tracks. We have kind of done some this weighting process to get older data from 2010 tracks into the 2020 track geography, so we can preserve these time trends that you see here. You kind of see how things have changed in the neighborhood over time. Poverty rates going down a little bit, median income is going up, monthly rent is going up a lot. My understanding is on the west end of this neighborhood, there's some gentrification going on. So that's one thing you can learn from these data tools. So yeah, that's it. There's like a couple other Savvy data tools, but these are probably the most relevant to any kind of needs assessment work. So if you have any questions about these tools, you're more than welcome to contact us. We can walk you through any issues you have.
Yeah, absolutely, Jay. That was super helpful. I'm a visual learner personally, so it was awesome to see like the tangible tool right in front of me and see how it works. And it seems like there's a lot of data and insights that you can get out of this. So we appreciate your demonstration. Um, Now we'll take some time for our attendees to ask you guys any questions. So if you would like to come off of mute or drop a question in the chat, we will take advantage of the rest of the 20 minutes that we have these experts on our call. Jay, Jackie, Nisa, if you guys also, if you're comfortable dropping your contact information in the chat as well. So if anybody has any questions or wants to make contact and get some additional insights, I'm sure they would love to be in contact with you all. But if anyone has any questions, now's the perfect time. Like I said, you can feel free to come off mute or you can put them in the chat and I'd be more than happy to read them off for you. Thanks, Jackie.
Hi guys, thank you so much for this presentation. I was struggling with my Zoom a little bit. I made a mistake. So you may have said this and I apologize, but I'm wondering if you could say something about, and if you said this already and I need to follow up with you separately, that's fine too. But I wondered if you could say something about the value of collaboration in some of these studies, like cross-agency studies. I know that what we find, like with the requirements for the Salvation Army, is that sometimes it makes the studies themselves quite expensive. And so just wondered about your experience with that, highs and lows of that, things to avoid, things to think about, those kinds of things.
I don't think Big Brothers Big Sisters has done a collaborative community needs assessment in conjunction with anybody locally. I think we benefit from being a part of a national network of Big Brothers Big Sisters. So we've had studies done that we've been able to benefit from other, like through other affiliates to be able to get that information. Sorry, Rachel, I don't think I have enough information to be able to answer that question. I don't know if Nisa or Jay have experienced that either.
Similar. I mean, we've been tackling it ourselves in terms of the data collection and really haven't partnered to be one of the outside entities to assist with that process at this point.
Yeah, so I guess my answer is probably the same as I've been talking, collaboration in a data sense where, we would assist other organizations or, we've operated as a contractor in some of those community health needs assessments. But I mean, I think your, point is valid, and certainly, if it's a possibility, I think that would probably solve more problems than it might create.
Thanks for that. I know, especially like I was listening to some of you talk about the value of sharing that information across the community with collaborators so that you're all learning together and able to assess the needs that are being revealed together. It just seems wise to me to collaborate on the process of discovery. So thank you for that.
Thanks for questioning, Rachel. Nisa, Jackie, Jay, Clark has asked, are there any new trends or suggestions you can share on how to approach measuring or benchmarking individual qualitative data to add to community quantitative data? And that is listed in the chat if you need to process that a little.
Yeah, so I mean, just to talk a little bit about qualitative data. When qualitative data is just kind of like descriptive data about, in this case, individuals. And you wouldn't think it would be so hard, but, it's like its own, area of study all onto its own. And so even though it sounds simple, I kind of have to say, I'm not the qualitative expert guy. I mean, we have done other people at Polis that have done some qualitative analysis, and it's a lot more work than you think it is. And even, like maybe you need to be using certain software to do it, like in vivo is something that we've used. But I don't know if you want to kind of get, all into that. But I think it's a harder question than, it really sounds.
Jackie, Nisa, would you guys like to speak to that?
So much of our data is qualitative data. I mean, we are on calls, we are in meetings, we document basically everything about all of our folks who are in our program. And I'm not the data person at our office, so there may be somebody at our office that I can check back with to get a better answer as to like what are the trends for being able to measure this better. We luckily do have like a Salesforce database that is how we track all of our contacts and interviews and assessments of every single program participant that comes through, in terms of how to roll that up into like one really great tell all kind of assessment. I mean, I feel like that's still a bit of a process and something we're constantly trying to reassess. So I don't know if I have an answer for you. I apologize.
No worries, Jackie. Nisa, do you have any insights you want to add, or?
No, I just want to echo the difficulty of measuring some of that qualitative data compared to quantitative. That is a theme that we have seen throughout the processes that we've done the past few years. And that is actually why we added a quantitative process to our portion to our process this year in 2023, because it was so difficult. We found the best use is the determining umbrellas and themes and working from there. And really, that's honestly also why we hired a third-party data analysis this year to help with that qualitative piece, just because of the sheer difficulty.
Thank you, Nisa. Any other questions that anyone has? Any insights? Anything you want to speak to?
I think I'm thinking about Clark's question a little bit more and like measuring the impact of mentorship is a very like I think personally like pretty difficult thing to do, because it's not like we are handing out X pounds of food to people, right? It is trying to measure a person, which is hard. And so I just kind of thinking about that. I mean, we try as much as possible to get some type of individual quantitative data. So we do tons of surveys of folks that, funnel into our database. We're able to draw from that. But then also we do have kind of what we call youth outcome development plans that we set with the youth and the family early on, the beginning of the relationship, trying to figure out goals that they want. We constantly try to find opportunities to check back in on those goals, create new goals for the next year that a mentoring relationship is together. And then we use all of our information that we grab when we're contacting and calling with these folks to be able to then feed into, okay, what is the growth that we're seeing? But qualitative data is pretty subjective, like being able to, again, roll that out up into one. Luckily, we have a great staff at our organization who are able to kind of individually assess all of our program participants to see impact and growth. Not necessarily a trend or a suggestion, but I know that we try to combine some individual quantitative data with qualitative data to be able to put it all together.
That's good insight, Jackie. Well, are there any other things that you guys want to leave the participants with in regards to community needs assessments, leveraging their results, the unique perspective or approach you can take at every organization? Anything you want to leave them with?
One thing I will just add is that ensuring that you hear the voice from the entire community that you're trying to seek input from. And one thing that we have learned through that process is going to them, making sure that we are intentional and meeting them where they're at, whether that is utilizing our current network of community partners to get that information out, whether it is creating new relationships, whether it's going into the churches and into community centers and other entities in our community to meet community members that we typically do not have relationships with. Because it was, especially at the community foundation level, we want to hear from all community members. So just keeping that in mind to be intentional, and especially through the process of making sure that you're hearing from all voices.
Thank you, Nisa.
This has been a terrific conversation. I'm really grateful to all of you and to our colleagues here on the call that we were able to take some time together, do some learning together. You know, this community is full of shared expertise, and I love that we're able to share it with each other here. You know, we've got the foundation from the philanthropy side, and Savvy from the university side, the Full Center, and then one of our longstanding community partners of Big Brothers Big Sisters. And so it's been great to see kind of all of those different perspectives come together here. One of the things that we really try to be attentive to is that the topics for these conversations come from this group and are for this group and are by this group. And so wanted to just give a moment to, if anyone has any topics that they would like for us to discuss, if this spurred an idea, or if you've been struggling with something at your organization and would love to troubleshoot that by talking about the topic more with others. Drop it in the chat, send us an email. We would love to hear from you. We have a few ideas still from some past conversations, but would love to continue that thread. So send us a note if you have that. But at this point, I want to thank all of our panelists, and we're so appreciative of the work that you do each day, appreciative of the time that you gave us to give of your experience, to give of your time. We know that everyone is really busy, and there are many other things you can do with your time on a Friday morning at 8:30. So thank you for sharing with us today. And to all that are on the call, I hope that this fall weekend brings you a time to recharge and reconnect, and that in the coming month that you're able to continue to meet your own community needs assessment, whatever that looks like, from qualitative to quantitative. If that's connecting with someone in your neighborhood, if it's connecting with a client, but having those connections along the way. Some of that is very hard data, but some of that, as we heard today, is just really being connective and being proximate to community. So grateful for all that you all do to do that every day. Have a wonderful weekend, everyone, and we'll see you next month.